Welcome to another live recording of the Nursing Home Podcast, the podcast which you've become accustomed to getting a different intro every single time. But additionally, the place where you look for real information about the nursing home industry to know what's really going on, the things that you cannot Google. In today's episode, we are going to carefully discuss the concept of some of the challenges specifically related, I think, to infection control, but maybe not limited to that, um, that exist right now in the nursing home industry. To do that, we're introducing today to the podcast Dr. Buffy Lloyd-Krejci, who is helping prevent infections in nursing homes, is author of the book called Broken: How the Global Pandemic Uncovered a Nursing Home System in Need of Repair and the Heroic Staff Fighting for Change. Dr. Buffy, welcome to the Nursing Home Podcast.
Thank you so much for having me. Glad to be here and have this great topic of discussion.
Yeah, we are very glad to have you here as well. Um, Before we jump in, if you don't mind sharing with our listeners a little bit of your background and how you got to doing what you're doing right now.
Yeah, well, I'll just say I've been in healthcare for over 30 years in different capacities, and most specifically in the last 10 years in epidemiology. I've been studying over 10 years, actually, epidemiology and infection prevention and control. And really, since 2016, really a targeted focus and mission to supporting nursing homes, implement evidence-based practices to reduce infections, keep healthcare workers safe, keep residents safe. So that's my mission and drive is really reducing infections in the nursing homes.
Amazing, amazing. This is definitely always a challenge when you take a lot of people who have, somewhat compromised immune systems and other conditions in a fragile state, and you put them together, and lots of people coming in and out, going to the hospital, picking up some infections and sharing it with their friends, and then going back out and continuing that cycle. But let's focusing specifically on COVID.
Mhm.
What has your journey been like? I know that you've been in and out of facilities. What was, I guess, in what professional capacity, and then we'll discuss maybe some of your discoveries.
Yeah. So I really dove in going into on the front line supporting nursing homes in June of 2020. I worked with the Doctors Without Borders first ever US based mission. They're a humanitarian organization that have been around for over 50 years, and they had never had a mission in the United States. So they came into the United States. They chose nursing homes amongst some other areas in Detroit, Michigan, and I was hired as their infection control manager. We would go into nursing homes in the Detroit region. Those that had COVID, we'd go in and work with their staff, identifying gaps in infection control and how we could rapidly help them implement best practices right away to help prevent the spread of infections. I then went on to, they had a second mission in Houston, Texas. I went to support them there. And to be honest, haven't really stopped. My home base is Arizona, supported local and state health department, different initiatives, and going in and out of facilities. All in all, I was in hundreds of facilities across the country supporting nursing homes with COVID that had COVID to help reduce the spread rapidly as we could once it got in, and then also provide tools for them to try to keep it out as much as possible. So really been active and involved in the mitigation and the strategy to contain this virus.
Fascinating. So this is not an armchair analysis of the nursing homes or COVID or anything like that. This is, you don't get more boots on the ground than this. And you've been there, you've watched COVID come in, you've been involved in managing it, trying to make sure it doesn't come back in or it doesn't go to other places, minimize the effect and all of that. And that itself could be a whole separate conversation. But let's we've spoken quite a bit about COVID, in this platform. But let's focus maybe more specifically. What are some of the things, I guess, the gaping holes in systems and other things that you've noticed that are broken
Yeah.
um, in the nursing home space? And I will say that neither of us are here to bash or hurt.
Nope.
I'm only saying neither of us because you told me beforehand. Um, nursing homes, nursing home operators, we understand the struggles. The point is to point out some of the areas where some of the weaknesses, and then hopefully, maybe even discuss the sequel to Broken.
Yeah. No, I'm definitely an advocate. My passion is to help the nursing homes, to help the workers. So many of the things that I've seen and experience every day when I talk to nursing home operators and work with the staff is they want to do the right thing. They want to deliver good care. It's just they're often limited based on funding, based on lack of staffing. I mean, there's a whole range of challenges that prevent our nursing homes to truly be successful. And I'll just say I never planned on writing a book. I was pretty busy, so that was not really what I needed to do. But I really felt compelled because out of the hundreds of facilities that I was in across the country, I kept hearing the same story over and over again. The lack of support, the lack of supplies, the regulatory agency coming in and pretty much fault finding in the middle of a crisis, and handing out citations versus support, and it was just absolutely devastating to the nursing home operators and to the staff. It just weakened the morale, and I really felt compelled to write this story because, as the general public, what we often see and hear is the bad side of the nursing homes. We don't get to see the heroic staff that are showing up every day under these very difficult circumstances and challenges to care for our loved ones. And so what does that do? That makes us afraid that of putting our loved one in a nursing home when they need that care. And it just doesn't equip us to make change. It actually, even as consumers of this healthcare, these services, it actually just makes us have this bad attitude and worry and have anxiety, maybe, instead of learning what we can do to advocate and even support our local nursing homes.
Well, so that was very well said, and I will say that I couldn't agree with you more. A big push for starting this podcast is because I've seen together with everybody else the devastation that the media does to nursing homes, and it sometimes has very practical effects. There are nursing homes that have been forced to close down,
Yes.
and for for no real reason. Taking a report from Department of Public Health. I'll name that regulatory body, Department of Public Health, and sensationalizing it and making it a big story and something that, first of all, one of the heaviest regulations and strictest regulations from any industry.
Right.
It's very, very heavily regulated, and unfortunately, like you mentioned before, you humbly mentioned that you've been to hundreds of facilities across the country. So, if you're not credentialed to give an opinion, then who is? And I know personally of cases like this, and you shared the same thing, where there's a COVID outbreak. So instead of receiving, the type of support that maybe Doctors Without Borders is and other organizations may be providing, you're literally having surveyors walking up and down between sick patients, looking for citations and pointing out the obvious. Hey, there's no staff here. We know that. People are petrified to come in here. Every single person who's in here right now, we're literally putting our lives at risk for other people. Like, these are from the best human beings on the planet.
Hmm.
And instead of being, heralded as heroes for coming in and doing, everyone else is at home, bunkered up, worried about toilet paper. They're here hands on caring for the people who cannot care for themselves. And instead of, instead of recognizing that, or at least allowing it to happen, literally getting in the way and, showing, hey, you don't have enough staff. Really, would you like to care for this patient? Do you have
Right.
someone that you can send? Are you going to, do you have supplies that you can bring? So it's just, it's so frustrating. Um, yeah, I know I've said this on the podcast in the past, but initially when I started as an administrator, I naively wanted to believe that we're all on the same side of the table, and the caregivers and the regulators. And sometimes that's true. And that definitely is sometimes true. And I'm not saying that all regulators are bad, but as a whole, I guess it's broken. I mean, like really, really broken. And I think everybody can agree that it's important to have people driving on the highway, and it's important to have people enforcing that the rules to have rules, and someone has to enforce that they're followed. Who does what? Everyone will go to where they naturally gravitate, and that applies to nursing homes as it does to fast food chains and nuclear power plants and hospitals and hotels and anything else that should, maybe not hotels, but that should be regulated. Um, but it should be in a supportive way. It shouldn't, the way that it's done, like that's such an obvious, blatant deviation from a mission, if there is one. Why are you handing out citations? There was a call. All right, I'm going to let you talk in a minute. You just got me worked up a little bit.
I love it. I mean, this is
There was a call with a bunch of operators of a certain state, which will remain nameless for now. But I know people who are on that call with the governor of the state during COVID, when many of them had outbreaks in their buildings, discussing the new staffing regulations that were going into place. And everyone's just like listening and hanging their head and like, okay, so a new set of citations is going to come out, and there may or may not be financial penalties. But then someone had the guts to speak up. Mr. Governor, where do you expect us to get these people from? We have COVID in our building. People don't want to work here. They're risking their lives. We can't tell them that they're going to be safe. Administrators died, DONs died, nurses died, CNAs died from COVID that
right.
they got from their patients. These are facts. Everybody knows that, and it's definitely it's a big risk. Yes, of course, with proper infection control, prevention, all that, um, they can mitigate the risks. But people don't want to come, and then the same government that's heavily regulating or unreasonably regulating the industry is also giving out, not anymore, but at that point, untold amounts of money when they literally making more money staying home than coming. So you could stay
Right.
home, make a lot of money, or risk your life and work crazy hours um, in a nursing home. So which one will you choose? And now that you cannot convince those people to make the completely unreasonable decision to come in, um, and now you get penalized for that. All right, I feel better. Thank you for listening.
Well, I just want to add to this scenario. I love the talk about, people drive, and so we have, police officers that, we regulate the speed. Now imagine if there's a category 5 hurricane barreling in on your city and you're told to evacuate. So you're told to evacuate. However, at the same time, the number of police officers has gone up maybe 7 times to make sure they're pulling people over and giving them a ticket if they're speeding.
Right.
Now, what part of that would make any sense at all? Right? You're in the middle of a crisis, you need to get to safety, but we're going to pull you over and give you a speeding ticket. That's essentially what has happened during COVID, where all CMS surveys were suspended. Hospitals, outpatient, nursing homes, every one of them was suspended. But nursing homes were actually, the surveyors were funded $80 million to do targeted infection control surveys for nursing homes only when they had an outbreak. So just as you described, during their darkest hour, when they have no PPE, half their staff have quit or they're sick, state surveyors walk in the door, not to help, not to say, let us help you, but to literally stay on site for days, watching every single thing your staff do and citing them for any mistake. Citing 2 nurses, citing them for not disinfecting a pen when they're sharing it between nurses. Stuff that wasn't significant. And when you have $80 million that is towards a process, how are you going to prove that you're actually using those dollars appropriately? Well, the more citations you have, this shows you're doing your job. And that's what the expectation was. I talk in my book, I have several examples in my book that describe the devastating effects of this process for the nursing homes when they were doing everything they could to keep our residents alive, to provide care. And from the very beginning, this was the federal response for our nursing homes. From the very first outbreak in Washington, this is really what set the stage. So not only were we underprepared, the whole nation was underprepared. Every healthcare setting was underprepared. Long-term care, I would say, was even more unprepared because our infection control practices weren't quite as robust as what we have in hospitals and other healthcare settings. It was very difficult to get PPE if we weren't part of a large hospital system. And so we really were kind of pushed, and then were required to take patients with COVID, whether we wanted to or not. We were forced to. And so whether we were prepared or not, whether we had the staff or not, we were forced to. And then we had a survey process that came in and pretty much pounced on us more. This truly was the greatest pain that I experienced and heard from operators and staff all over the country. It wasn't so much COVID because, in long-term care we rally, we are scrappy, we make do, we get things done. But it was the survey process at a time when the guidance and recommendations were changing, sometimes daily, twice a day. And they were no longer recommendations, they were law. And if we didn't follow every word to the way it was written, we were cited. I mean, I helped facilities across the country IDR, the fight the state surveys, and they would quote us word for word what the CDC said, even if it had been different 2 weeks prior, even if it had been different 5 days prior. They would write their citation based on what the new guidance was. It was just impossible. It was impossible to keep up. And it just wasn't, it's so inappropriate and harmful. And I don't know about you, we've always had turnover in long-term care. That's no surprise. But now I'm seeing people that have been in it for their whole career, administrators, DONs, executive, people that have really given their life to this work. They're leaving because they're like, it's too much. We want to do a good job, but we're in a straitjacket and can't. So my plea to the public, to the government, is help us do the right thing instead of constantly punishing us and expecting us to deliver quality care when we're constantly getting knocked down.
Very well said. We could definitely hear the passion and the pain, which is not just for you, but which is for all the other facilities that you visited and the ones that you haven't.
Right.
Um, I would add to it that I don't think that there's cruelty that's intended with some of this supervision. It comes from a reaction to public opinion, which is generated and sensationalized in the media. So when there's a strong public pressure and it's perceived that nursing homes are killing people during COVID, right? That's the narrative that's being regurgitated over and over and over in the media, and nursing homes became the center of attention in the beginning, right in that's how it came
Sure.
into the country, right?
Sure.
Initially. So now it's like, oh my gosh, government, you have to protect our delicate and fragile seniors. What are you going to do? So there's money. Now what do you do with the money? So now that's I probably where forget the nursing home system. That's where the government system is broken, where instead of taking that money and channeling it towards PPE, now
Right.
nursing homes didn't even have money.
No.
Even if they had access to it, but the
Right.
prices were insane at that point. So instead of providing them money for staffing, and I wouldn't again, we're painting with broad strokes here. That there have been funds that definitely were available, and the government did give out COVID payments. Maybe too little, too late. I don't know if it's too little, but maybe too late. and not at the right times. But it's really, and government is not government. There's many. We're oversimplifying it this here,
Right.
but the point is, it doesn't change what happens boots on the ground. And truth is, before COVID, it wasn't as pronounced, but that system was broken before COVID as well. The regulations. What other industry do you have it that they can be daily writing new rules and new laws? You're immediately responsible for it, and literally to the letter, literally to the letter. And if anything is changed, even slightly, you're going to be held completely liable, completely ignoring the overall goal, which is to provide a dignified existence, and in this type of care setting, which is so, like you said before, just so necessary. There's just
And
so
I'm
there's so
not
ne-
I'm not against regulations. I mean, we do need regulations in this healthcare setting. We need responsible regulations. And instead, what's really kind of happened is, you have one bad facility or one bad incident happen, and then the whole in response to that, we throw tons of more regulations at the industry. And it's crippling now because the burden is so great. Um, it's impossible really to operate under.
100%. I mean, I would want to take a pause here just to focus on a comment that I think you can see on the screen now as well. That taking all relevant precautions is always important. So it's showing up as LinkedIn user. I've worked directly with COVID-19 patients throughout these last years. Most of my colleagues have not been affected. I felt I had a higher chance of getting infected outside the hospital, which comes from that type of can-do attitude, like you said, which exists so much in long-term care. But I agree, taking care of COVID-19 patients does take a toll even on the best of us, which is true. And like you mentioned before, so many people have and are unfortunately leaving the industry because they just said enough is enough. We care about it, but we care about ourselves as well. But let's move on the conversation, if you don't mind, to within the nursing home itself. What other systems within the nursing home um, were highlighted through COVID? And I would definitely want to get to maybe some possible things that anyone, whether it's administrator or director of nurses or even infection control specialist, which became a very important role, even more important role in many facilities. Some of the things that they may be able to do.
Yeah, I mean, so, before COVID, I very much was an advocate in implementing evidence-based practices, infection prevention practices in our long-term care facilities. We were starting to get there very slowly before COVID, and then we were just kind of thrown in the deep end, like ready or not, here you are, right? I mean,
Mhm.
November of 2019, the federal rule was to have a part-time infection preventionist on staff. But what I want to say about that is we need that role, but unfortunately, because of our staffing shortages, that infection preventionist cannot typically only do infection prevention, right? They have to the DSD or the MDS coordinator or the ADON or the director of nurses. It's very rare they get to devote that time. And what I see is they're very, very green. So many infection preventionists, they're one day they walk into work and they're assigned the infection prevention role because they need to have that designated role. And so even before COVID and during COVID and long after, we need training, we need education. So one of the things that my company does is we do boots on the ground still. We're going into dozens of facilities every month. We're working on with a as a collaborative partner, as a mentor, a coach. We work with the infection preventionist and we support them. We celebrate what they're doing well because we all need to be celebrated. And then we identify the gaps in their infection prevention program, simple things that don't necessarily have to cost money to fix, just some different way of thinking and training that can really make their job a lot better. So we really need this more supportive, collaborative work. And I'm very much an advocate for boots on the ground. A lot of our public health support comes remotely because it's more cost effective. I totally get that. But we need support in the buildings. our staff need us, the nursing homes need us. And again, not the only people coming in the building are typically the surveyors. We do have, through the Department of Health, we do have the CDC's division, the HAI, the Healthcare Associated Infection Epidemiologists. They'll come on site and do like an ICAR. I know some states they're much more robust about that, which is awesome. And we need more of that. So I would say that support, that education and training, our nursing homes are hungry for that. They want that. Our staff wants that. And we need to be able to provide that more.
Yeah, I would just like caution. I mean, you know this, but if that support is coming from the government, they're going to be very reluctant and probably not as receptive if they're coming in as an official member of Department of Public Health or an associated government body, because there's a big lack of trust
Sure,
between
100%.
operators. Like, oh, we're coming from the Department of Public Health. We're not giving out any citations. We're just coming to help. Yeah. Mm-hmm. And then,
Well, you are 100% correct. And actually, with the Department of Health, they are bound if they do have certain criteria. If they do see something, they have to
right, the
report it to
mandated
licensing.
reporters.
They do. So, so that is the biggest challenge I even have, and even working with Doctors Without Borders, is gaining that trust right away. Like, we are truly here to help you, and we're not mandatory reporters, and we are here to support you and coach you and guide you and help you. And so, once we're there for a few minutes and we start giving them some training and education, I think they get that and they're like, okay, they really are here to help. But
Right.
that's the biggest hurdle. I mean, we offer free on-site support for hundreds of facilities. And that's the hardest part, is getting our foot in the door to help them, because they're so used to the punitive nature that they're like, no, thanks. Nah, we'll pass.
Exactly.
you
Very
know?
well said. Right. It is a very punitive type of environment, which is like, even during survey, you'll have a nice survey. Will say, "Oh, let me just show you. Maybe try it this way. Maybe try it that way." Going back to the highway example, it's like a nice cop saying, "Oh, here, just pull up like this. Oh, you jumped the stop sign. Oh, you just told me to. What? You still jumped the stop sign." Doesn't say in the regulation if a cop tells you to do it that you're off the hook, right? So, and that's kind of what people come to expect. Um, we could probably go on much longer about this, but let's shift gears specifically to solutions. So if we, someone's, let's say, an infection control specialist in the facility, and they're green, like you said, and they really want to step up their game. So you spoke a little bit what we can do for that, but let's shift from there to staffing. What have you seen from staffing levels, and what do you think is something that maybe facilities can do right now to address that problem?
Well, first and foremost, um, facilities, any actually person watching this podcast today or anytime, they can reach out to their state representative, their congressman or woman. They can reach out to their senators. The TNA program, the temporary nursing assistant program, actually went away June 6th, which was 3 days ago. And that program actually was instrumental in helping us get people in the building and to have a pathway towards becoming a certified nursing assistant. And right now that's so critical because, with inflation and the rates high everywhere, people need work now. So if it's going to take them 3 months to go through a CNA training program without pay, they're going to go get a job somewhere else. Versus this TNA program, they can start work immediately in the facilities, and then the facility can train them up and go through it to where then they can become a certified nursing assistant. So we need that pathway, and we've been told by CMS it's going to take an act of Congress to bring it back. So let's reach out to our representatives and tell them we need this. Especially with the staffing shortages that we have right now, this is a no-brainer, and it's not requiring any funding from the government. The nursing homes pay for the training. It's been a tremendous support to getting staff in our buildings. There's definitely calls right now for 24/7 nursing on site. What I say about that is, just like what you said earlier, if we don't have the staff to bring them in, we can't mandate these items until we have the staff that we can support to do the work. So but in order to be able to bring in the staffing, we need to be able to have competitive wages. There's also on the books, and actually people have till tomorrow, June 10th, to write in there's a proposed budget cut for a 3% from CMS. And, we don't need budget cuts from Medicare. We need increases. So this budget cut, the proposal is that it happens in a year. And, the industry is like, no, we'll just expand it over 3. We'll take the cut, but just don't make it all at once. So, you can write to your legislators and ask them to extend this, and not, we just can't take these financial hits right now as an industry. We need to pay our staff competitive wages, or we won't have staff, and then we won't have an industry. And we need post-acute care. Like, we need it. And I'll just say, in my book, I talk about post-acute care is not just for elderly. I mean, I talk about a 24-year-old in my book that was in a car accident and needed 6 weeks in post-acute. I talk about a mom that son was in a nursing home for 20 years. So we need to care more, and we need to support this industry more.
Yeah. Yeah, I hate saying it out loud, but I know that it's true. And you just said it. You said it yourself, which is why I'll take the liberty. You said we need to care more. Um, the real truth is, our society as a whole, or decision makers as a whole, numbers don't lie, as they say. So where we allocate our resources tells us the level of importance something has. By making cuts in such a vulnerable, barely surviving industry, it unfortunately is indicative of where the decision makers see this on, on the general scheme of things. And it's unfortunate, but I think that is the reality. And even if, which I completely disagree on so many different levels, even if someone doesn't share the same respect, fascination, really respect is the right word, and the dignity for our seniors. But like you pointed out, this is not other people. This is everybody.
Everybody.
There's plenty of post-acute care. Someone goes through a very significant surgery and doesn't have a home setting that they can go to recuperate properly. They may need some inpatient rehab care. Almost every nursing home is called a nursing and rehab center. It's two separate services. Right? There's a rehab service which has nothing to do with old people. And the fact that there are cuts coming down, yeah, I don't like saying it so much. The people who go into this, by the way, people also say you see a guy pull up to a nursing home in a big fancy car, let's say, and owns 10 nursing homes, 20 nursing homes, whatever it is. And people are like, whoa, he's driving such a fancy car, and look, I'm still making $12.50 an hour. You realize that this same businessman could have bought hotels, could have bought cryptocurrency, and could be did. And this is just a part of the portfolio. And they're choosing to invest their time, money, and resources into this industry. I'm sure that financially it makes sense for them, but many of them, they care deeply about the people that are cared for in their facilities. I'm not speaking for everybody, but this certainly is the case. This is a business that they want to be busy with all the challenges, and it starts from the very top, but from it should, and a healthy company start from ownership level and all the financial stakeholders. I'm not even saying down or up, but including, whether it's the CNAs, the housekeepers, whether it's the person fixing the oven in the kitchen, or whoever it is, it just it comes from such a place, and it's important that we realize who's who, on whatever level that they're on. So solution based, number one is the TNA program, which certainly helped. Solution wise is reaching out to our government officials, which certainly is a first. It's a step. Are you familiar with? I'm not. Are you familiar with any? Or maybe I am. Organized efforts to sway the government opinion in regards to the TNA program. So I know they have all the associations. I'm just thinking here, of all the different nursing home associations. So they do put pressure to try and change.
Yeah, I mean, I was in DC on Monday and Tuesday on Capitol Hill with ACA and NCAL, and there over 500 of us that were talking with our House representatives, senators, and really advocate. That's why we have until tomorrow, basically. Well, tomorrow is for the Medicare cuts. That's kind of the time period we have to write about that. The TNA program, that just basically went away on the 6th. So, but yes, we were in Washington, advocating for change, and that we need the government approach. We need that support. It's just everyday people, but they're making decisions that they don't necessarily know about, right? And so we have to be the voice, and that's very important, because we need to bring these issues to them so they can make the right decisions. Because I think that it's easier to kind of do things the way we've always done them. And with this system being so punitive, it's kind of easy just to lean in towards that. And so it takes courage to say, you know what, we're going to do it a little bit differently, and see if we can get some different results from that.
Amazing, amazing. Dr. Buffy, it's been amazing having you on the Nursing Home podcast. One last thing before we let you go, and then I want you just also to share the information about your book and where people can get it. But just before we get to that, what do you see as the next 2 years in the nursing home industry? Where do you see, like, best case scenario, where we can be? What would be considered success and progress? With an eye to the future, in regards to the regulatory enforcement, in regards to staffing, in regards to everything we've discussed.
Well, for me, if we did nothing about changing the regulatory enforcement, let's just say that stayed the same. Let's put the same effort towards collaboration and support. Let's put the same funding, if not more funding, towards actually assisting our nursing homes, more boots on the ground, more coaching, training, educating. And let's just stop throwing punishment at them and pointing out what they're doing wrong. But let's actually reach our arm across and help them to be successful. So, we need to do that, absolutely. And I'm not even saying, fine, let's not, even if we don't change anything about the regulations, let's put that amount of effort into helping and supporting, and that collaborative effort. We need to be more proactive in preventing infections. The research shows anywhere from 40 to 70% of our infections are preventable. So we really need support in that area too. Again, coaching, guidance, training. We need to help our nursing homes. And I think if we took that approach of how can we help them versus we're going to punish them because of all the horrible things they do, I think we can go a really long ways.
Amazing, amazing. Really would hope to see that actually happen, and to see that shift. You just got me thinking. Is that something else that you said, like, if we continue um, as is, or continuing leaning into the way things were, might not be so pretty. It's time to change things up a bit. One of the things that's important for us to realize is that nursing homes are not the same. They're a completely different institution than what they were 30 years ago or
100%.
60 years ago. That they're not places for everyone who calls it the little old ladies, where they're knitting and playing bingo and doing whatever they're doing, and it's the place where they're living. It's the community hospitals of yesterday. So
Very
nothing has
true.
adjusted. Reimbursement is not adjusted. The regulatory compliance is not adjusted for that. The hospital regulations is less. It's
Right.
less punitive. It's less
Sure.
enforcement. And over there, we're talking. The deaths happen there all the time. And are those preventable? Maybe. I mean, that's a whole industry I
Sure.
don't claim to be an expert in. But there's no reason why they should have less regulation.
Right.
But that is the way that it is. If somebody wants, so your book is out, Broken, as you
Yes.
mentioned in the beginning of the podcast. Um, so give us the blurb about your book, and if someone can pick up a
Yeah.
copy.
Well, like I said, I've really felt compelled to write this book and tell the story. It's not just my story. It's interviews from nursing home administrators, staff, patients. It's interviews from academic researchers, even the regulatory side of things. I had our Arizona bureau chief interviewed her to give a really well-rounded perspective of what's going on. I talk about what happened before the pandemic and how we were really ramping up and starting to really focus on infection control. And then, of course, what's occurred during the pandemic, the challenges our nursing homes have had to endure. And then really the last few chapters are leaning into the solution. What can we do? How can we support our staff? How can we support best practices? How can we change the broken regulatory system from constantly being punitive to more supportive? And really what that looks like going forward. And then the last chapter is even towards consumers. What does it look like for you caring for your loved one? If your loved one is a nursing home, what can you do to advocate for change and to support and support the care that your loved one is receiving? And there's a great story in there about Twyla Bridges, who cared for her son who was in a nursing home 20 years, and her great advocacy and work that she did. And so this is the first step. The book is on Amazon. You can get it. It's available. Hope you will purchase it and share it with everybody because this is an issue that we as a society really need to work on, and because every one of us is really touched by this issue.
Amazing. We can definitely share a link to that. Okay, I'm waiting to see when it's going to be available on Audible. Okay. Maybe.
Oh, I got to get that out.
uh,
I think I need to get on that sooner rather than later.
Especially a lot of the people that should be reading this book spend a couple hours a day commuting.
Sure.
That's when I got really into all that stuff. But that's amazing. Thank you so much, Dr. Buffy, for coming on the Nursing Home Podcast. To listen to this podcast and to listen to previous episodes, you can head on over to thenursinghomepodcast.com, or you can go to any other place where you get your podcasts. Again, thank you so much for coming on the show. We definitely appreciate you sharing your perspective with our listeners and viewers.